Questions. Number 1. The nurse is preparing to start an IV infusion. Before inserting the needle into a vein, the nurse should apply a tourniquet to the client's arm to accomplish which of the following? A. Distend the veins. B. Stabilize the veins. C. Immobilize the arm. D. Occlude arterial circulation. Right answer, A. Distend the veins. Number 2. The sudden onset of which of the following indicates a potentially serious complication for the client receiving an IV infusion? A. Noisy respiration. B. Pupillary constriction. C. Halitosis. D. Moist skin. Right answer, A. Noisy respiration. Question number 3. A client is receiving an IV infusion of 5% dextrose in water. The client loses weight and develops a negative nitrogen balance. What nutritional problem prompts the nurse to notify the healthcare provider? A. Excessive carbohydrate intake. B. Lack of protein supplementation. C. Insufficient intake of water-soluble vitamins. D. Increased concentration of electrolytes in cells. Right answer, B. Lack of protein supplementation. Question number 4. A nurse is administering IV fluids to a dehydrated infant. What intervention is most important at this time? A. Continuing the prescribed flow rate. B. Monitoring the IV drop rate. C. Calculating the total necessary intake. D. Maintaining the fluid at body temperature. Right answer, A. Continuing the prescribed flow rate. Number 5. Normal osmolarity of NS.9%. A. 273 MOSM per L. B. 308 MOSM per L. C. 245 MOSM per L. D. 395 MOSM per L. Right answer, B. 308 MOSM per L. Question number 6. Which of the following IV cannula used for blood transfusion? A. 16G. B. 18G. C. 20G. D. 26G. Right answer, B. 18G. Question number 7. If hypertonic solution given by peripheral line, it will cause A. Thrombophlebitis. B. Infection. C. Hematoma. D. Phlebitis. Right answer, D. Phlebitis. Question number 8. RL solution contraindicated in A. Burn. B. Septic shock. C. Lactic acidosis. D. Heart failure. Right answer, C. Lactic acidosis. Question number 9. Most common IV site used for an 8-month-old client. A. Basilic vein. B. Cephalic vein. C. Radial vein. D. Scalp vein. Right answer, D. Scalp vein. Question number 10. Doctor has prescribed oxygen as needed for an infant with heart failure. In which situation should the nurse administer the oxygen to the infant? A. During sleep. B. When changing the infant's diapers. C. When the mother is holding the infant. D. When drawing blood for electrolyte level testing. Right answer, D. When drawing blood for electrolyte level testing. Question number 11. A nurse assesses that several clients have low oxygen saturation levels. Which client would benefit the most from receiving oxygen via a nasal cannula? A. Has an upper respiratory infection. B. Receives many visitors while sitting in a chair. C. Has a nasogastric tube for gastric decompression. D. Exhibits dry oral mucous membranes from mouth breathing. Right answer, B. Receives many visitors while sitting in a chair. Question number 12. A client who is admitted with chest pain, shortness of breath, has a standing order oxygen via mask. Standing orders for oxygen mean that the nurse can apply oxygen at A. 2 liters per minute. B, 6 liters per minute, C, 10 liters per minute, D, 12 liters per minute. Right answer, B, 6 liters per minute. Question number 13. A nurse is administering oxygen to a client with chest pain who is restless. What method of oxygen administration will most likely prevent a further increase in the client's anxiety level? A, cannula, B, catheter, C, Venturi mask, D, rebreather mask. Right answer, A, cannula. Question number 14. The parents of a child with spasmodic croup ask why their child is receiving humidified oxygen. What effect of humidified oxygen should the nurse include in the explanation? A, minimizes tissue edema. B, provides a mode for giving inhalant drugs. C, increases the surface tension of the respiratory tract. D, provides an environment free of pathogenic organisms. Right answer, A, minimizes tissue edema. Question number 15. Doctor orders oxygen therapy via nasal cannula at 2 liters per minute to an older, confused client with heart failure. Which nursing action is the priority? A, maintaining the client on bed rest. B, determining whether the client is agitated. C, obtaining a cannula of appropriate size for the client. D, investigating whether the client has chronic obstructive pulmonary disease. Right answer, B, determining whether the client is agitated. Question number 16. The nurse walks into a patient's room to find a lit cigarette in a trash can. A fire begins. Which of the following actions should the nurse do first? A, pull the fire alarm. B, remove the patient and family members from harm's way. C, close all doors and windows close to the fire. D, locate the fire extinguisher and attempt to extinguish it. Right answer, B, remove the patient and family members from harm's way. Question number 17. Which rationale should a nurse use to explain the reason for oxygen being bubbled through a humidifier to a client receiving 2 liters of oxygen by nasal cannula? A, prevents the burning sensation of direct oxygen. B, prevents the drying of the nasal passages. C, prevents a chemical reaction between the tubing and oxygen. D, prevents contamination with environmental gases. Right answer, B, prevents the drying of the nasal passages. Question number 18. A 4-year-old child is hospitalized and diagnosed with mild intermittent asthma. Oxygen is ordered via a simple face mask. A nurse should plan to instruct the parents that which items can be harmful while oxygen is being administered. A, plastic blocks and handheld toys. B, electronic educational toys and books. C, cotton-filled toys and clothing. D, synthetic toys and clothing. Right answer, D, synthetic toys and clothing. Question number 19. When oxygen therapy is being used, no smoking signs are posted because oxygen, A, is combustible, B, is explosive, C, prevents the dispersion of smoke particles, D, supports combustion. Right answer, D, supports combustion. Question number 20. Oxygen concentrations of 70% can usually be delivered with the use of A, a nasal cannula, B, an oropharyngeal catheter, C, a non-rebreathing mask, D, a Venturi mask. Right answer, C, a non-rebreathing mask. Question number 21. The method of oxygen administration primarily used for patients with COPD is A, a nasal cannula, B, an oropharyngeal catheter, C, a non-rebreathing mask, D, a Venturi mask. Right answer, D, a Venturi mask. Question number 22. The leading cause of death in fire victims is believed to be A, cardiac arrest, B, carbon monoxide intoxication, C, hypovolemic shock, D, septicemia. Right answer, B, carbon monoxide intoxication. Question number 23. A client with a deep decubitus ulcer is receiving therapy in the hyperbaric oxygen chamber. Before therapy, the nurse should A. Apply a lanolin-based lotion to the skin. B. Wash the skin with water and pat dry. C. Cover the area with a petroleum gauze. D. Apply an occlusive dressing to the site. Right answer, B. Wash the skin with water and pat dry. Question number 24.